Coronavirus or severe acute respiratory syndrome. Coronavirus is a virus that attacks the respiratory system. This disease due to viral infection is called COVID-19. The coronavirus can cause minor disorders of the respiratory system, severe lung infections, and death. Severe acute respiratory syndrome coronavirus 2 SARS-CoV-2, better known as the coronavirus, is a new type of coronavirus that is transmitted to humans. This virus can attack anyone, such as the elderly, adults, children, and babies, including pregnant women and nursing mothers. The COVID-19 virus was first discovered in the city of Wuhan, China, at the end of December 2019. This virus is spreading very quickly and has spread to almost all countries, including Indonesia, in just a few months.
COVID-19 is passed from someone with the SARS-CoV-2 virus to another person. This disease can be spread through droplets or water droplets from the nose, mouth, or the other parts of the human body. And droplets are fluids from the human body, such as from the nose and mouth. And then there's several ways how the transmission COVID-19 occurs between humans. First, transmission can occur when a person infected with COVID-19 coughs, sneezes, or talks, and droplets or small particles called aerosol carry the virus into the air from their nose or mouth. And second, a person can also catch COVID-19 if they accidentally breathe in the air containing the virus. Research shows that the virus can live in the air for up to 3 hours. And third, another way to catch the coronavirus is when you touch a surface where someone who has the virus coughs or sneezes. Virus can live on surface such as plastic and stainless steel for 2 until 3 days.
Early symptoms of coronavirus infection or COVID-19 can resemble flu symptoms, namely fever, runny nose, dry cough, sore throat, and headache. After that, the symptoms may disappear and heal or even get worse. Patients with severe symptoms can experience high fever, cough with phlegm, and even bleeding, shortness of breath, and chest pain. These symptoms appear when the body reacts against the coronavirus. In general, there are 3 general symptoms that can indicate someone is infected with the coronavirus, namely fever or body temperature above 38 Celsius, out of breath, and dry cough. There are several other symptoms that can also appear in coronavirus infection, although they are less common, namely diarrhea, headache, conjunctivitis, loss of taste ability, loss of smell or anosmia, and rash on the skin. These symptoms of COVID-19 generally appear with 2 days to weeks after the patient is exposed to the coronavirus. Some patients infected with the coronavirus can experience decreased oxygen without any symptoms. This condition is called happy hypoxia. In order to ascertain whether these symptoms are symptoms of the coronavirus, a rapid test or PCR swab is needed.
Until when are we silent and selfish? Let's do the 3M movement. What are the 3M movement? The first 3M movement is wearing a mask. Wear a mask when you leave the house. The recommended mask is a 3-layer cloth or medical mask. Don't forget to wash cloth mask after using it. Put on the mask to cover the nose and the mouth. Make sure there's no gap between the mask and the face. The second 3M, namely washing hands. Washing hands is one of our ways to break the chain of the virus. Make sure there is a soap and a running water, or can use hand sanitizer that contains at least 60% alcohol. The last 3M movement is to maintain a distance. We don't know who is healthy or sick, so don't forget to always keep the minimum distance 2 meters from other people. We must work even harder to always remind ourselves, those around us, and other people to continue to implement the health protocol, namely 3M. So, there are no additional cases and the pandemic will be end soon. This increase in these cases is not only the saddest moment, however, also to be reminders that we always carry out about this protocol.